Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Suicide deaths and attempts have reached epidemic proportions in Montana. In fact, in 2016, Montana topped the list for the highest rate of suicide in the nation. So why is Montana the epicenter of suicide? And why, for so many, is Montana becoming their last best place? I'm Janet Whitmoyer, and this is Healthy Living for Life, a show dedicated to helping you do just that. Stay tuned. Welcome back. My first guest is Carl Roston, who is a suicide prevention coordinator with the Montana Department of Public Health and Human Services. Welcome to the show, Carl.
Thank you.
Let's start off by talking about Montana being the highest in the nation for suicide, and actually we've ranked up there at the highest or near the highest for 4 decades. Mm-hmm. Can you tell us what's going on in Montana to cause this?
Well, it's important to understand that this isn't a new issue. We've been in the top 5 for the last 40 years, but we've been high for 100 years. We've been in the top tier state for suicide for nearly 100 years. And it's not just Montana, it's our region. If you take a look at the top 10 states for suicide, it's pretty much right down the Rocky Mountain region. And there's a number of issues that play into that. Social isolation, substance abuse, specifically alcohol, access to lethal means, primarily firearms. We have huge stigma when it comes to mental health, especially depression, and that's probably one of the greatest ones. But we also have altitude. You know, the altitude is a correlation with suicide. So there are a number of factors that play in, and it's multiple factors occurring at the same time.
Okay. So are you seeing a certain age group where we're seeing a higher rate of suicide in the state?
The highest, and this is both nationally and in Montana, it's middle-aged white men. That 35 to 64 is the highest. In Montana, it's 35 to 44 is the highest in our state.
Wow. Nationwide, you talked a little bit earlier about the stigma of mental health. And nationwide, 90% of the people who die by suicide have been diagnosed with some type of mental illness. Can you talk about how mental illness plays into suicide in Montana?
Yes, in Montana, it's about 83% of those who died have a diagnosable mental health issue. Most prominent is depression. About 69% of the time it is depression, far exceeding any other diagnosis. The depression piece has a lot, many times it's a suffering that people go through for sometimes weeks, months, sometimes even years. And because of the stigma, they do it silently, because there's a lot of shame and guilt associated with it. And so many times people don't talk about it, they keep it silent and they suffer. And then when the pain exceeds the ability to cope, that's when we see a suicide attempt or a death by suicide.
Okay. And we're seeing a lot in the news lately about high school students and teens who are completing suicide. Can you talk about what's causing this to happen in Montana, where teens feel the need to complete suicide?
And I think it's important to understand Montana youth is about almost 3 times the rate of suicide for the same age group nationally. What we see some of the same factors as we talked about why Montana's high. Access to lethal means. You have kids are often impulsive. They do things without thinking. There's about 30% of youth suicides occur within an hour of the first thought. Wow. But there's other factors. We have a culture of kids coming up, and not just Montana, nationally also, that have limited or fewer and fewer skills to be able to deal with adversity, fewer coping skills, and that is a huge factor.
Okay. As a parent, how could I tell if my child might be at risk or contemplating suicide?
There's a couple things that we advocate for. One, and this is both a national recommendation, but also what we're recommending in Montana, is universal screening for depression starting at age 12. That 86% of parents who lost a child to suicide didn't even know their child was depressed. As parents, we lose our objectivity. It's hard for us to think about our child wanting to die. So working with your pediatrician or your schools to have a screening is the first piece. But then also awareness. Educate yourself about what are the warning signs of suicide, how do I intervene, what are the resources that are available in our community.
Okay. And I know there is also a TV show on Netflix called, I believe, The 13 Reasons Why. Can you explain to us a little bit about what that TV show is and what your perspective is on that show?
Sure. 13 Reasons Why is a very popular show on Netflix right now. It's because it follows an adolescent who's going through a number of social stressors and peer pressures and bullying and that type of stuff, and she becomes suicidal. The original intent of the show was to raise awareness. Unfortunately, it's had a kind of a negative effect. It glorifies and glamorizes suicide, which is one of the biggest factors that we see when we have what we call a suicide contagion or a spread of suicide. But also, it fails to connect the correlation between suicide and mental health. And so we have seen a number of kids that have actually increased suicidal thinking. And what we're really advocating, I think our first decision would be to tell parents not to allow their child to watch it. But the minute you do that, it makes them want to watch it. I think probably the better thing to do is to sit down and watch it with your child, and then process the information and use it as an opportunity to learn and have open communication with your child.
Okay, and kind of along that lines, there's another phenomenon or maybe an internet show or challenge called the Blue Whale Challenge.
Yes.
Can you tell us just a little bit about what that is?
Sure. This was actually started in Russia and is an internet challenge game. And there's 50 tasks, but each task desensitizes the person to death. And the 50th challenge is for them to take their own life. And this has been associated with a number of suicides in Russia and England and has now come over to the United States. And we've had some as nearby, some from our smaller schools in Montana and definitely in other areas of the country.
Okay, and just real quickly, I have one more question. Some people might be afraid to bring up the issue of suicide with somebody. Is that something that we should shy away from, or is that something that really we should be talking to family members about?
We absolutely need to be talking about it. There's a myth out there that people are afraid to bring up the word suicide because they think it'll put the idea in the person's head. There's not 1 ounce of research to show that. You can do no harm by asking somebody if they're suicidal. And asking somebody if suicidal validates the person's pain, gives them an opportunity to talk, it opens up communication, it lowers impulsivity. It's the best thing that you can do. Well, and we'll end on that great piece of advice, and thank you so much, Carl, for sharing your information with us. Thank you. We'll be back with our next guests who have faced suicide head on and have emerged stronger and with a message of hope. Stay tuned.